So I first met Shannon back in 2018 as a family medicine physician within the same organization that I work for at Intermountain Health. We started working together on a regular basis at the beginning of 2022 when we both took jobs with a population health company as associate medical directors. First impressions of Shannon, even when I didn't know her well, is clearly it stands out that she is a leader and that she wants to improve primary care, not only for herself and for her patients, but for the providers that she works with as well. Shannon has a passion to do so many things, all within the world of bettering primary care and specifically family medicine. Over the past year and a half, I've seen her dedication to teaching medical students, to teaching healthcare providers how to improve their practice and efficiency, and even teaching me how to become a better leader, hopefully a better speaker, and overall a better person as well. Her involvement in organizations, even outside of her daily job, is an exhaustive list and really quite incredible. Her work with the UAFP board, the Intermountain board, her work with the population health company, with women as leaders in medicine, and then of course the teaching role that I mentioned as well. Her passion and dedication to improve, it never stops, and it's with the highest quality that I think I've seen in a provider.
Shannon leaves people, places, and things better than she finds them. I think as an individual, she looks for opportunities to make things whole, and as a result of that, she just bends over backwards, I think, to help individuals and processes and workflows and medicine, whatever really Shannon touches turns into gold, just in the aspect that she is out to make the world better, and that is very relevant in the things that she does on a day-to-day basis.
So I started working in West Jordan and then found out that I was pregnant with triplets. And my partners from Saratoga Springs, I think Dr. Baker had reached out to them and said, "Hey, I'm moving back to Utah." And they said, "Hey, you should talk to our partner who's having our old partner who's having triplets." And so she kind of came in and took over for me. She started before I left. And then she kind of was really helpful with kind of keeping my patients under control while I was gone, because I took, I think, about 3 or 4 months off after they were born. But the great thing about Dr. Baker is we have a very similar practice style. And so we can see each other's patients, and it seems pretty seamless because we both kind of treat our patients the same way, and it works out great. So she really cares about her patients, I think, as everybody does, but she also has a really good rapport with them as well. And I think she just is really patient. She tries incredibly hard to be on time with things and get back to patients and make sure she's answering and responding to them in a timely manner. And they just really trust her. So I think she's just really good at open communication and taking great care of them.
I mean, the first thing that I notice about Shannon really is that she's an internal optimist. She's always got a smile on her face, and it doesn't matter what we're talking about. And often the things that we're talking about are complicated, right? The experience of primary care and the improvements that happen. Sometimes they become complicated and it gets a little uncomfortable, but Shannon's always got a smile on her face, is always willing to kind of bear the cross there that we oftentimes get to bear in family medicine as we're looking to improve the care that we give to our patients and communities. She's just a really optimistic human, and she has a strong sense of pride, I think, in family medicine and primary care in general. I've oftentimes felt a little bit bad about overusing Shannon. You know, oftentimes what will happen is we'll say, hey, we need a trusted physician colleague to speak up in a meeting or to present at a conference about such and such a project. And her name always comes up, right? So she always is somebody who we lean on as kind of an early adopter, optimistic human who can really help other physicians and teams see that there might be a better way to do things in primary care that help our patients and that help our primary care teams. So she's always been that person who raises her hand first. And unfortunately for her, that means we bring her into different meetings and conferences to present on the work that she's done and kind of these experience moments that she has. And I mean, the reason that works for her is she's a fantastic physician, right? She's definitely patient-centered. She's got a heart of gold and understands, I think, the complexity of healthcare and how there are probably better ways to do things. And so she's always willing to try in the name of helping her patients and helping her team. And she's always successful. Like, she always has a good story to share. I think even sometimes when the project may not have gone quite as planned, she's one that learns something on the fly, tweaks it, and then is able to improve on it on the fly. So she's an invaluable asset to family medicine and really to her clinic and our teams.
Congratulations, Shannon. Can't think of a more deserving individual. We're so excited for you and think that this is well-deserved, and excited that you're receiving this honor. We really appreciate all that you do, both for our patients and for our community and for our organization.
Congratulations, Shannon. This is very well-deserved. Not only for just your role in taking care of your patients, but also all of the different committees and things that you've been on, all the things that you're working so hard to improve on and improve for us physicians, and just being like a dedicated leader and someone who I can always lean on and talk to.
Shannon, congratulations. Of course, we all know this is well deserved. You're a fantastic physician. I look up to you. So hats off, Shannon. You know what we think of you and what I personally think of you. I can't thank you enough, and I am so excited that you got this award.
Shannon, congratulations on winning this award. I can't think of anyone who's more deserving, and I know that you wouldn't want people to know about all these things that you've done, which makes part of you being so incredible. I would also want to say thanks for helping me to drive me to try and work harder and become more like you. I think one of the important emotions and feeling that we can have in life is to be inspired. And you're certainly someone who inspires me to be better. And it's certainly those around you as well.